Welcome everyone to the Society of Thoracic Surgeons Congenital Heart Surgery Database monthly webinar. Today is Tuesday, February the 18th, 2025. So thank you everyone for joining today. All right. On the call with me today, let's see here from the STS side of things, we have myself and Emily Conrad, Banu Yatsi. We have from our consultant team, we have Chastity and Leslie and Melinda. Nancy Honeycutt is also on, as well as Paul Meehan. So thanks everyone for joining today. Unfortunately, I don't think any of our surgeon leaders are able to join us today unless Dr. Meyer is able to hop on at some point. But thanks everyone for being on the call today. In terms of agenda, I just have a super brief STS update, and then I'm going to turn things over to Chastity and Leslie for our data manager education. And then as always, we'll finish things up via the Q&A. Please be sure to submit your questions via the Q&A function, not in that chat box. If you'd like, you can also just raise your hand, and we do have that raised hand function enabled. Just make sure that your microphone is enabled. So feel free to use that if you wish. So let's go ahead and get started. All right, STS updates. Again, like I said, just some brief updates from my perspective. February training manual is posted and available out on the STS website. The 2025 harvest schedule, the spring harvest is scheduled to close March 21st, with our fall close scheduled for September the 26th. I know last month I gave an update on the primary procedure mismatch report update, and I was hoping that that was going to be available last week. However, IQVIA is still working through the updates to that prim-proc mismatch report. So right now, the prim-proc mismatch report is tentatively scheduled to be available on Friday, February the 28th. We will send a formal communication to everyone, letting you know that the new report is available. So if you are submitting data right now, please keep in mind that the new rules have not been applied to that prim-proc mismatch report. So again, we will send that formal communication to you, as well as we'll include surgeons as well, introducing the new rules that are being implemented. So just a reminder, the new process was effective January 1, 2025. Just a brief recap is replacing exception 1, also known as, excuse me, the procedure-specific factor rule, and it will be implemented in this current spring 25 analysis. And just a reminder that we initially provided our education back in November, so you can take go back and listen to that November webinar, and Chastity is also going to give an additional recap today here in just a moment. Also, just a reminder for the CHSD risk-adjusted report, that calculation spreadsheet, that resource is available for you in the IQVIA library. And just make sure that resource that you're using is dated December 13 of 2024. That's the last time that resource document was updated. So just make sure you're referring to the correct version. AQO 2025, just some brief announcements. So AQO 2025 will be held October 2nd and 3rd in San Antonio, Texas. We will be at the Grand Hyatt San Antonio Riverwalk Hotel. The CHSD and GTSD sessions will run concurrently. They will be held on Thursday, October the 2nd, with the ACSD session following Friday, October the 3rd. We will offer both in-person and virtual options, as we've done in the past, so they will both be available. And we will be sharing cost information with you as soon as we have the information. So as soon as it's available, we will share that cost information with you. Also this year, we do have a session proposal document, so you can go out and via this link and out on the STS website submit a session proposal request. So we'd love to hear back from you to get your ideas on what you would like to hear presented at this year's AQO. We just want to make sure that we are giving you the content that you are wanting and needing. So again, the deadline to submit those proposals is April the 18th. And again, you can just learn more about submitting a session proposal via this link here. If you have any questions about AQO, just please let us know and we'll get those answered for you. That's all that I have. Like I said, I had a super brief STS update. So now I'm going to turn things over to Chastity. Is going to kick us off first with the primary procedure mismatch report update.
Absolutely. Thank you, Leanne. You can go to the next slide. Because as
Ma'am.
Leanne said, we're going to start with the new primary procedure determination rule. This was rolled out to you in November, specifically November 19th of last year. So if you migrate over to the STS website, you'll see the November 19th webinar that's posted there. And so much more detail was presented there with examples and lots of tables. So I do urge you to go back and read that. The training manual was also updated with this very specific information in December. And so you can refer there as well. But essentially, we're referring to this as the procedure specific factor rule update. So you will see much of the existing rules that were in place prior to this are crossed out in the training manual and the new rules applied. So remember, this is rolling out in the spring 2025 harvest. So what is getting ready to close in March 21st. And this new rule update will be applied retrospectively for the 4 years involved in the analysis in the spring 2025 harvest. So that will be surgery dates from January 1 of 2021 until December 31st, 2024. And as Leanne said, the IQVIA primary procedure mismatch report is nearing completion. So if you were to upload a file now, you're going to need to re-upload again after the primary procedure mismatch report does launch and has these new rules incorporated to make sure that you have selected the correct primary procedure. Next slide. So just as a recap, again, and what is listed in the webinar and in the training manual, the new rule states if a procedure in column B is performed as part of a multi-component procedure that includes a procedure from column C, the primary procedure will be from column B unless the operation includes an additional simultaneous procedure that has a higher stat score. So again, in the webinar, we go through multiple examples. So I do urge you to go back and look at that webinar. But if we go to the next slide, I did bring in an example. So just a reminder, when the report does launch, when the IQVIA primary procedure mismatch report is relaunched, the report functionality will remain unchanged. It will look the same, and it will still have what the participant has listed as the primary procedure, and then also what the determined STS primary procedure is. And again, it will incorporate these new rules. And of course, you'll be notified once the report does release. So here's a mismatch example. So, and this is directly from my database. So there is a procedure where a patient underwent a bidirectional cable pulmonary anastomosis, a PA banding procedure, the creation of an ASD, and then takedown and ligation of an existing shunt. So per the pre-existing rules to this new launch of rules, the bidirectional Glenn would be the primary procedure. And that was just based on the rules of it being a benchmark operation, and it has procedure-specific factors, hence the coined term of the procedure-specific factor rule. Now, what you're going to see, if you had a case like this, that the primary procedure mismatch report shows that my participant designated primary procedure is the bidirectional Glenn procedure, whereas it is now saying, based on these new rules, procedure 1640, the PA banding, is the new determined primary procedure. So like usual, I would want to go in and have my data match what's going to be analyzed. So it's recommended we do this, that I would go in then and make the PA banding procedure the primary procedure of this surgery, and it will no longer be the Glenn procedure. Next slide. And as we go through, if you wanted to double check to make sure the IQVIA report is correct, or that you're understanding, and perhaps even need to explain to your program why you're going to have the loss of a Glenn analyzed in the database, we look at column B and column C. And remember, the rule is if a procedure done in column B is done at the same time as something listed in column C, then the primary procedure will be from column B. And so we know that our column B procedure is 1670, the bidirectional Glenn, and the PA banding procedure is not listed in column C at all. So next slide. So following the rule, the PA band has an associated stat mortality category of 1.2 or score of 1.2, category 4, whereas my Glenn procedure has a stat mortality category of score of 0.3, category of 2. Therefore, my PA banding now it does have a higher stat score. And so because of that, and it is not listed in column C, it will become the primary procedure following the new updated rules. Next slide. Oh, and so I'm going to transition over to Leslie. Obviously, if you have any questions, please feel free to submit the questions to Leslie and I when you start working the report. And we're happy to, at the end of the call here, to also answer any questions that you have regarding the primary procedure determination.
Yep. Thanks, Chas. And also just of note, before I get into this next change, Leanne did add bookmarks to the training manual. So right at the top, it says new primary procedure rule. So you can go directly to that if you'd like in the training manual. You might have said that actually, sorry. Okay. Analysis updates. This has to do with overlapping episodes of care, and this will be coming spring 25. It will be reflected in our analysis overview. We'll talk more about it when the reports come out, but we want to give everyone a heads up that it is coming with the next analysis. So what this is sites questioned which case is analyzed when a patient has 2 index operations, which occur within 30 days of each other, but it's over 2 separate admissions or 2 separate episodes of care. So currently, both operations are analyzed, but if the patient expires, the second case is designated as the mortality, and the first would be deemed a survival. Also currently, post-operative events are followed through 30 days. So this has created some overlap and duplicate capture when those episodes of care overlap, and that's actually where these questions started coming in. So the task force then decided to review some examples and kind of see what would happen if these rules were changed. Next slide. So as an example, a patient is admitted to your hospital and has an operation on January 1st, and then they are discharged to home on post-op day 8. Then the patient is readmitted and has another cardiac operation on January 20th. Next slide. So this represents 2 separate episodes of care. The first one for their first operation, the follow-up period ends January 31st. And the second one, when they come in and they have an operation on the 20th, that episode of care follow-up period ends February 17th. Next slide. But between those 2 dates, that January 20th and when the follow-up ends for the first care, January 31st, there's overlapping data capture. So what that ends up looking like is for episode of care 1, you're going to collect an unplanned readmission to the hospital and an unplanned cardiac reoperation. Both of those relate to that second episode of care. Next slide. And then, of course, on the second episode of care, you're going to say there were no intra or post-operative events, assuming just based on the information here, I'm just giving broad strokes, but you'll say no intra or post-operative events. So that looks very clean. And then the current analysis, this would be analyzed as 2 separate episodes of care, each with an index operation, each as a survival. Next slide. But let's say after that January 20th operation, the patient is unable to come off bypass. They convert to ECMO. They have another cardiac reoperation, and the family ultimately decides that they'd like to withdraw care on January 25th. So again, all of those things that occur between January 20th and the end of that first follow-up period are going to be collected on the first episode of care, and then of course as well on the second one. So next slide. So that now you're going to have your unplanned readmission, of course, your unplanned cardiac reoperation, your post-operative ECMO, and it would be an operative mortality for your first episode of care. Next slide. And now on your second episode of care, you have an unplanned cardiac reoperation, you have post-operative ECMO, and you have this designated as an operative mortality. Next slide. But we know that a patient can only die 1 time per participant ID. And so right now, we ignore that operative mortality on the first episode of care, but we don't ignore the events that have happened on either one. So I purposely didn't give examples, a specific procedure, but you can kind of imagine that if this happened to be a benchmark procedure or a stat category procedure, or a lesion specific procedure, that these would be reported out in different tables in our analysis. So the task force decided that that really didn't make a whole lot of sense. And if we're not, obviously going to count the operative mortality twice, why would we be duplicating, capturing all of these events? They reviewed many, many more procedure examples that I'm giving you, but by and large, these were reoperations for like mediastinal explorations, infection, and there were some redo cardiac operations. But what they decided then was that really everything that happens in that second episode of care is a complication of the first. So to be consistent with what this would look like if that patient was still in house, they decided to move forward with ignoring that second episode of care and subsequent mortality and analyzing everything on the first. Next slide. So now your second episode of care will not be analyzed. It will just be the first episode of care along with the postoperative events and the mortality as well. Next slide. Okay, so in summary, I'm a visual learner, so I tried to put those together visually, but it is hard to do. So in summary, if 2 index operations occur within 2 separate episodes of care, and that happens within 30 days, so index operation date 1 and index operation date 2 is within 30 days, then the first index operation will be analyzed. And this will be the same whether it's a survival or a mortality. Functionally, this is going to work the same as anytime you have subsequent operations within 1 episode of care, because that 30-day range keeps going. This will be analyzed beginning the spring 25 harvest, and it will be applied retrospectively. And the exclusion criteria, will be updated in the analysis overview. And just as a reference as well, this is extremely rare occurrences, but we did want to let everyone know before you got a report back where there were things ignored. I believe it was approximately 300 cases across the entire database, which accounted for 0.3% of index operations. And like I said, those were by and large not stat categorized reoperations, but there were some. Next slide. Okay. So we'll give you a second to think about that. I think there's a couple questions we can start going to.
Yeah, sorry, I couldn't find my mute button.
That's okay.
Sorry, but yeah, so if you have questions, again, just please put those into the Q&A. Let's go ahead and write the first question from Amy. Once the new primary procedure mismatch report logic releases, will the old logic still be there for prior reporting periods? So no, the old logic will not still be there. Once they update the prim-proc mismatch report, it'll just be based on the new rules. But that also kind of plays into Kelly's next question. Will it show mismatches for the 4-year time frame? So yes, so it'll show mismatches for that 4-year time frame. And next Kelly's question, Chas and Leslie, do we have to change our data for the 4 years?
Great question.
So, I mean, we highly recommend that you would have your data match what's going to be analyzed. I think it makes it easier when you're locally reporting your data that it does match your analysis. You are not required for your primary procedure to match what will be done in analysis. And remember, there are still those existing mismatches for 341 cases because IQVIA points out that let's say a 5,000 code, one of the new combo codes should be primary, but it's a 341 case and you cannot code the 5,000 code in that instance. So those mismatches will still exist and you'll have to ignore those in the primary procedure mismatch report as you've been doing for the last few years.
Right.
Leslie, is there anything else you wanted to add to that?
No, I was going to just clarify though on Amy's, the logic that comes out with this analysis period is for those 4 years.
Right.
Prior to that, it's whatever rules applied.
Right. Yep, sorry, thank you for clarifying.
That's okay.
Brooke, does the logic that Leslie explained apply if the first index operation is a PDA less than or equal to 2.5 kilograms or a pacemaker less than 30 days?
Great question, Brooke. To my knowledge, yes, it applies. This will functionally work exactly as if the patient was still in-house for that time period. So right now, if the patient had a PDA and they weighed less than 2.5 kilos at the time, but then went on to have a more significant, I guess, maybe not, another cardiac operation, that next one is still not analyzed. As my understanding is today, that is going to be the case with the new logic as well.
David had his hand raised, so I'm gonna jump over to David really quickly. All right, David, I've unmuted you. If you can unmute on your end, you should be able to answer or ask your question, possibly. Maybe, maybe not. Oh, sorry, no question. Okay, no worries at all. All right, I think I can lower your hand. Yep. Our next question from Emily. Is any logic changing for analysis for episode of care if a patient transfers from one hospital after an index hospital to another hospital where they have another index procedure or hospital and dies? Will this still count as a mortality for both hospitals?
Good question, Emily. This will still count as a mortality for both hospitals. There's currently no report or logic update to handle that. There's no way for anyone to know at analysis that that's still the same patient transferring hospitals. So as of right now, that part is not changing.
Great question. Has a new data manager training session date been decided? That is a great question, Liz. Chas, Leslie, and myself are meeting. Actually, I think we're meeting tomorrow, and we will work with Emily and get that date scheduled. I know we talked about it, and we're talking about how we're going to do the data manager webinar. So more information to come ASAP. So we'll share that as soon as we have it. Next question from Amy. Will there be a report to identify the index cases that occur within 30 days in 2 separate episodes of care?
There will not. That is a wonderful suggestion. It has been suggested by many. There is hope to have a full exclusion report in the future, but as of right now, there will not be. So if you, same as we go through other exclusion criteria, if you notice a patient was not included in a table, we're going to update the analysis overview so that you have kind of the whole list to work through. Is this a PDA less than 2.5? Is this a pacemaker? Is this an overlapping episode of care, et cetera? But we are taking that suggestion and we will add extra votes that happen sooner than later.
Yeah. Yes, exactly. Like Leslie said, we're working on that, having that report for you all, the exclusion report of why a record was excluded from analysis. So the STS DBA analytics team is working on that. So we're working on it, I promise. Let's see. Next question. If a patient initially underwent a PDA less than 2.5 kilograms, then during the same hospitalization, greater than 30 days, underwent MV repair, will the second case be analyzed as a mortality under new rules?
Nope, the same rules apply. So that patient, upon analysis, it will be identified that the PDA ligation is their index operation. But because they were less than 2.5 kilograms, it will be excluded from analysis. And that will not make another procedure index at all. No changes there.
Okay. All right. Let's see here. Hold on, a Q&A. Oh, that okay, thank you. Just really quickly, I know we don't have any other questions coming in as of yet, but I just wanted to point out, Emily did include a link to the 2025 AQO Data Managers meeting into the chat, as well as a link to the session proposal form into the chat. So yeah, just wanted to point that out. Question from Cindy, episode of care changes beginning with spring 25 harvest apply retrospectively. How far back?
Yep, that's for the full analysis period. So in spring 2025, we will be harvesting data from January 2021 through December 31st, 2024. So for that 4-year window, it will be applied.
Becky said the chat's disabled. So, oh, attendees can chat. There we go. Does that work, Becky? So you should be able to see the chat now. But let me pull this over. So let me pull this over really quickly. So to get information on AQO, so to get information on AQO, if you just go from the STS homepage, go to education and scroll down to calendar of events. And you just scroll down the page here. It's right here on this third row, advances in quality and outcomes. Just click here and it'll bring you to our AQO page. And the link for session proposals is here. And I think Emily is reposting those links into the chat now. Thank you, Emily. And thank you, Becky, for letting me know. Appreciate it. All right. And just really quickly, our next, while we're just waiting for additional questions, our next monthly webinars are March. I can't believe we're almost done with February. Oh my gosh. Our next monthly webinars, March 18th at 12 p.m. Eastern, followed by our April webinar on April the 15th at 12 p.m. 12 p.m. Central, 12 p.m. Central. Kelly is asking, does anyone recall the webinar discussing how to capture blood products for adult cases when multiple procedures are done during one episode of care? Does anyone recall that one? I cannot recall, Kelly.
I can't either, but Chess and I can look into it and see if we can figure it out and send it.
Yeah, was it
Send it
back
your
when
way.
we were first rolling out the adult fields, perhaps?
Probably. Yeah, I'll try and go back through some slides too. So Kelly, if you just want to shoot me an email or if you just want to shoot me an email or Chassie and Leslie, we'll see if we can find that and get that for you. Another question from Amy. No problem, Kelly. On the overlapping episode of care, let me try that again. On the overlapping episode of care, assuming this will apply to all tables in the analysis, but can you please confirm?
Yes, Amy, this will apply to all analysis tables.
Right.
Which makes sense because the second episode of care won't be analyzed, right? So
yeah,
it can't show up anywhere else in any other tables.
Right. So yes. All right. Anything from our help desk team? I know we are coming up on harvest close here, within like 4 or 5 weeks. Any comments from help desk or feedback?
No, just the
Testing?
usual. Make sure you've submitted your data as early as possible. And also, if you haven't submitted in a long time, you might want to really get your data in soon so that you can make sure that we have the Schedule A's for all your surgeons, because we're still getting a lot of people tripping over that data check. So.
And also that you're not deactivated by the system, because if you don't log in for a long time, the system automatically deactivates you. And the last thing we want is receiving those kind of emails the last minute during harvest close. So it would be really helpful if you can log in like week before harvest close and check and make sure that you can log in and there are no issues there, that end as well.
Good point. Yeah, I think it's like, what, 30 days or something? You guys-
6 months,
6 months.
6 months it gets deactivated, right?
Oh, okay, yeah, yeah,
Yeah.
yeah. Thanks, Paul.
Mhm.
Days, that's. And Amy was like, not even table 1, so that wouldn't show up in table 1.
So the very first line of table 1 is everything that you submit. No, nothing is taken into consideration, so it still is in your overall total.
Right.
But as it goes through the exclusion application, it will not be an analyzed operation.
So I have a patient who had index procedure on 3/4, discharged 4/15. Readmitted, patient was readmitted on 4/17 and had an index procedure on 10/21. If this patient dies, the mortality will count for which index procedure?
Thank you for submitting it this example. So again, the overlapping episodes of care, that is going to be when the index operations, index operation date number 1 and index operation date number 2 are within 30 days. In this example, the index operation was on March 4th, and they didn't have another index until October 21st. So in this example, those are still treated as 2 completely separate index procedures. And if this was a mortality, it will go on to the index on 10/21. It does not have anything to do with how quickly you're readmitted. So even if you have an index operation, go home in a week, and then are readmitted 2 days later, if you don't have another, not you, if there is no index operation for 6 more months, this rule does not apply. It is only when index operation date number 1 and index operation date number 2 are 30 days, or within 30 days.
That's a great question. Diane, we should resubmit the full 4 years again after the new procedure rules on February 28th, right?
Correct. Since the primary procedure mismatch report and those new rules are going to be applied to retrospectively to the 4-year analytic window, you're going to want to make sure that you resubmit all 4 years of data if you are a program who wants your primary procedure to match what's going to be analyzed by the database.
And Janet had her hand raised. And I see your question, Janet. I'm sure you just want to, it's probably just easier to ask. Oh, wait, hold on. You should be able to unmute now, Janet.
Yeah, I just had some questions because it used to be that if you had a cardiac operation after your index operation and died within 30 days of that cardiac surgery, that rolled back to your index, kind of like your 30-day readmissions and your other complications. So does that same philosophy apply in this scenario? So you have an operation towards the end of your stay, you have a pacemaker placed, and then within 30 days you have a readmission and another cardiac surgery. Thank you.
Yep. The rule still applies if you have that later cardiac operation. It's still 30 days for mortality from that later cardiac operation. The overlapping episode of care rule, like when it's excluded from analysis, comes into play when index to index are within 30 days. It doesn't start a new count from that later, that subsequent cardiac operation. If those 2 things still overlapped, I believe, and they're looking into it because we asked this question, it goes to the second because it didn't exclude based on overlapping episodes of care. I hope that makes sense.
That makes sense.
Okay.
Great question, Janet. Thank you. All right. Excellent questions, everyone. And again, as Chas and Leslie said, the analysis overview will be updated with this information and will be released, subsequently with the release of the report results. So that analysis overview will be updated as well. All right. Any additional questions? I know we've got Get in a little early today, but just want to give you the opportunity to get those last minute questions in. Again, the monthly webinars, March 18, followed by April 15. And just a reminder for your help desk, the STS database help desk support, all analysis report, once those analysis reports do go out for spring 25, all report related questions and data submission questions, if you're having issues uploading your data, all of those emails should go directly to stsdb_helpdesk@sts.org. Database operational questions, you need to update your contact information for your site. You need questions about your contracts or questions about invoicing, please reach out to STSDB. If you're not sure who to contact, just contact the help desk. Just send them an email, just one person, and they'll forward it on to the appropriate staff. All right, David said, thank you for the presentation, Chastity and Leslie. As always, you guys did a phenomenal job updating the group with the OSO. This database is very complicated and very overwhelming. So, and you guys do a great job with your education. Abby, I see you have your hand up, so I'm gonna unmute you if you'd like to ask your question. If you have a question, I think you should be able to, oh, no question. No worries, Abby. All right. And again, here's our contact. My email is here. Chas and Leslie. Again, if you have clinical related questions, please do send those through the FAQ mailbox so they do not get lost or stuck in someone's inbox or buried. So again, just please submit your clinical questions via the FAQ to follow that proper process so we can track those questions accordingly. All right, I'm not seeing any additional questions come in. Thank you. I guess we can go ahead and end a little early. Thank you, Chas and Leslie, again for your phenomenal education. Appreciate you guys, and thank you everyone for joining. Thanks to my STS colleagues for joining as well. I hope you guys have a great rest of your week, and for those of us on the East Coast, stay warm. I hope you survived the little snowstorm we've got coming. So hope everyone stays safe, stay warm, and we will see you all on March the 18th. Look forward to it. Thanks everyone. Hope you guys have a great rest of your day. So yeah, AQO on Thursday, Janet. So AQO, CHSD and GTSD will run concurrently on the same day. So I'm gonna have to clone myself. But we'll figure it out. So yeah, AQO on Thursday.